Hello everyone, good evening. So am I audible to you? Am I audible? Okay, so I'll be taking a small quiz in this street. Yeah, so let's start. I hope all of you did many MCQs after orthodontics class was over. Okay, many of the questions that you'll be seeing right now, you must have not studied them. That's why it's a quiz, that's why it's a sort of test. So I just want to test how much you have read apart from what all I have taught you. Okay, and many questions are there which are from the same topics, are from the same thing which I have already told you, so it will be a good revision. Now, can anyone identify this instrument? See, I'll give you a hint that this instrument, there are two parts of this instrument. Actually, there are two pliers. One plier cannot do the job alone. Okay, so here we have two pliers. So it's like one male and one female. Okay, we have to hold the wire with the help of both of these pliers. We hold the wire with the help of this plier. Okay, and then using this plier, the second one, you hold the wire with the help of this plier, and then using the second plier you give a bend in the wire, a twisting bend, like this or like this. Okay, no, this is not De La Rosa, this is not Tweed. Okay, it is not that. So these are actually torquing plier. Okay, so these are actually torquing pliers. See, if this is a rectangular wire, okay, this wire, this is the cross section, this wire is like this. Okay, and I want to give a twisting bend on this wire like this. Okay, I want to twist the wire, but only in this section. Suppose I want to give a twisting bend or a torquing bend only on a central incisor. So what will I do? You cannot just take a single ply and just do like this. The whole wire will twist like this, the whole wire will just bend, like nothing will happen. You are just making the wire move. Okay, so with the help of one plier we hold the wire on this end and this end, and then using this other plier, okay, we take the other plier and then twist this whole section of wire in whichever direction we want. So this is a two-part plier. Like this torquing plier has two, they are not a single plier. Okay, so it is used to give torquing bends. So just remember this. In any image based question, if they have asked whatever the instrument is, and there are two instruments, not one, like you have mentioned De La Rosa or Tweed Ribbonage, they are all one. Okay, but here torquing pliers are two. You cannot give torquing bend alone with the help of a single plier. Okay, now which tooth is most commonly auto-transplanted in place of a missing maxillary central incisor? This was a AIMS INICET question. Okay? So if you have done your AIMS last 10-year papers or maybe 5-7 year paper, you must have encountered this question as well. Okay. So does anyone know what is the answer of this? Premolar. Correct. So here the mandibular premolar The mandibular premolar can be auto-transplanted in the position of a maxillary incisor. Then we have to wait for how long? How long should we wait before moving this tooth? We have to wait for how long? Can anyone tell? How long we should wait? 1 month, 2 months, 3 months, 4 months, 5 months, 6 months. Any idea how many months we have to wait before we can start with our orthodontic tooth movement? We have to wait for 3 months. Okay, before you start exerting an orthodontic force, okay, on that tooth. And obviously, after you have moved this, then you have to correct the shape of this premolar. Maybe we have to trim the premolar and make it flat so that it appears more like your maxillary central incisor. Okay, so remember this question. You can also transplant a third molar in place of a first molar. Okay, that is a second option. But first, remember the most common auto transplanted tooth is mandibular premolar in place of a incisor. Okay, canine see. Uh, Many people in many articles see when they do research, they will do with any tooth. They will auto transplant maxillary premolar also. They will transplant mandibular canine also. Everything. But we have to see that which teeth has the highest success rate. Okay, which transplantation method is most commonly approved among the orthodontists or among the various textbooks. So remember that premolar is the widely accepted tooth which can be transplanted in place of a incisor. Now who can tell this? I didn't teach this. I'm telling you straight away. Okay? I just want to see whether any one of you opened a book, or even if not, can you read this question and understand what is it? So the question is, what is the correlation coefficient between developmental status and chronological age? And what is the correlation coefficient between dental age and chronological age? Okay, see, the question means, suppose the first part of the question means, see, whenever we say na that the patient is 12 years of age and we say कि इसका growth spurt आ गया होगा, it is not necessary. ठीक है, that at 12 years, if there are 10 children, all of them are having the same amount of developmental status among all of them. Some might have a developmental state which is behind as compared to other. Some might be having, some might be early maturing. Their growth spurt has already occurred. Correct? So what is the correlation between chronological age and the developmental status? So the answer of this is this. Now I'll explain you what. So it means that see, zero point 0.8 ka square is 0.64. Okay. So it means that there is just 70%, you can say 64% relation. Okay. There is only 70% accuracy between your developmental status and a chronological age. That means that only 70% of the times you can be correct that yes, at 10 years of age this happens, at 12 years of age this happens. Okay, the second part, correlation coefficient between dental age and chronological age. Now this means that see, when we say that at 6 years of age molar erupts, 6 years of chronological age are first molar erupts. So it is not necessary, right? You know that in some children at 5 years of age the molar will erupt, or at 7 years of age the molar will erupt. It depends whether they are having early development of teeth or late development of teeth. Correct? So here the answer is 0.7. It means that 0.7 ka square is 0.49. That is, there's only 49% chance, or you can say only 50% accuracy between dental age and chronological age. So dental age is even less correlated with chronological age. See, many patients come, they say कि यार braces तो हमें किसी ने बोला था कि 12 years में start करना चाहिए, or someone is saying that braces are started at 11 years of age. ठीक है? When the patient comes to us, we say age doesn't matter. We have to look at the dentition, that what is the dental age of the patient, that whether the premolars are there, whether the canine is there or not, whatever it is. Okay, so the relationship between chronological age and dental age, remember, it is this, and the relationship between developmental stage and chronological age is point 0.8. This is 0.8, this is 0.7. Clear? See, by taking the square, we know how much in percentage we have the relation. Okay, this is all mathematical calculations. Okay, so you have to take square, and then you know this much percentage is the relationship between the following things, that is developmental state or chronological age, whatever it is. Okay, we have to take square. Now you can see three images. Okay, so auto-transplantation is when you take a tooth out of a position and you place it in a position of some other tooth. That is what auto-transplantation is. Okay, 70% accuracy is this. Actually, it is 64% accuracy. So we have roughly taken it as 70%. And this is actually 49% accuracy. So roughly it is 50%. Okay. Now, see which of the following depict relative intrusion. Who will tell? Simple. You can see in the figure. You can see in the image. Just test your mind. Relative intrusion. See, in the first image, can you see this arrow? So this arrow means that this incisor is intruding. So this is what? Absolute intrusion. So figure A depicts absolute intrusion, that the tooth is intruding. Correct? Figure C is what? Your molar is extruding. So this is extrusion. Okay. Here it is extrusion. Why? See, this image is actually slightly cut from below. Okay, the mandibular plane angle in this, it is showing like this, that it is becoming like this, and there was an arrow over here which by mistake I have cropped. It was showing that your mandible is rotating downwards. Okay, so with the molar extrusion, your full mandible is rotating downwards, so this is extrusion. This B is your relative intrusion. So relative intrusion means that with growth, okay, your ramus became longer in size. See, your full mandible has grown in downward direction because your ramus was growing in length. So this provided some space for the molars to extrude. Like in pedo, you must be studying nowadays that there are self-correcting anomalies. Deep bite is a self-correcting anomaly, correct? So what happens in deep bite? That when premolars and molars erupt, okay, and with the growth of your mandible, Okay, there is space for the molars to erupt, and in this space, when the molars erupt, your deep bite gets corrected. So from the front, it appears that the deep bite has corrected, your deep bite has opened, but it was not because of the intrusion of the anteriors. It was because of the extrusion of the molars in the space which was occupied by the growth of the ramus. So this is what is called as relative intrusion. So difference between relative intrusion and extrusion is, in relative intrusion your mandibular ramus becomes long because of growth of the mandible. Okay, and extrusion, there is no growth of the mandible. So with molars extruding, your mandible will rotate downwards. ठीक है, this is the difference between extrusion and relative intrusion. What happens in absolute intrusion? Your teeth will intrude. Okay, so yes, A was absolute, C is not apparent, it is extrusion. Okay, for mandible rotations, I've already explained in the class. You can see the recording. Okay, all the mandibular rotation. Now identify this. What is this? These. What is this? You can tell. Just imagine. What is the purpose of this loop? Yes. So most of you have said 3. It is correct. It is a torquing auxiliary. See, there is nothing called as box wire. I have just made that up. Okay? U loop is not like this. U loop is given in a bend, in a wire, sorry. Okay, so this is a torquing auxiliary. If you remember, can anyone tell that who developed these torquing auxiliaries? In which mechanism do we give torquing auxiliary? I'll give you a hint. It has a vertical slot. He developed torquing auxiliary. He used Australian wire for his treatment. He used an inverted ribbon arch bracket. I given many hints. So who developed this torquing auxiliary? Yes, Beggs. So torquing auxiliary was developed by Begg. So this is not Begg bracket. This is a normal bracket. ठीक है, edgewise bracket. But here they have used a torquing auxiliary to torque the canine. So here we are torquing the canine lingually. That root we have to torque the root palatally. ठीक है, it is applying a force like this, and this here we are torquing it like this, that the this tooth, the crown is going palatally and the root is coming labially. Okay, this is what it is. Okay, now tell me this, which of the following landmarks has highest error possibility in landmark identification? That is, when we are doing self tracing. Okay, when we are doing self tracing, we mark various landmarks. Okay, so among these landmarks, which of the following has the highest error? That the orthodontist or the dentist will be marking this landmark the most inaccurately. The difference between edgewise and MBT is that in MBT, see, MBT is a type of pre-adjusted edgewise bracket. Like MBT, there are many MBTs, orth, वगैरह. So MBT is a type of pre-adjusted edgewise. Okay. Yes, correct. Orbital. Okay. Now see, someone is saying point A also. Someone is saying Bolton's. Now see, in your textbook, okay, the main chart where it is written that which of the following landmarks has the highest error possibility, all of these landmarks have the highest error possibility. All of these are the answers. If you want to choose one, orbital is the one which has the maximum inaccuracy. Now, when an MCQ will come from this, only one of these will be in the option. Okay, like when this question came in AIMS, the answer was Bolton's point, but in among all these options, among all the four options, only Bolton's point was there among all these. The other three options were something else. Okay, so you have to remember this chart. Maybe you can say that the orbital has the maximum inaccuracy, then Bolton's point, Benton, ANS, AB, all these are also having a very high chance of inaccuracy. Okay, I'll tell you what tip edge is. Okay, so orbital is the one which has the highest error of possible highest error possibility in landmark identification. So remember this. Okay, now debonding of metal brackets occur usually at bracket adhesive interface, adhesive tooth interface. See, this is your tooth, this is your bracket. Now you apply composite between the bracket and the tooth, correct? Bracket is bonded with the help of composite. So when you remove the bracket adhesive interface means that this area, okay, when you remove the bracket, all the composite is left on the tooth and the debonding was done between bracket and the adhesive. Adhesive tooth interface means that when you debonded, all the composite came along with the bracket. Okay? And there's nothing left on the tooth. So with metal brackets, the answer is this, bracket adhesive interface. With ceramic brackets, the answer is this, adhesive tooth interface. Remember this. Yes, so composite will remain in teeth in metal bracket. So the answer is bracket adhesive interface. So all of you have almost told the correct answer. Okay. Yes, least error chance is with ANS and point B. Now tell me this. What is this? Can anyone tell what is this? Again, it must be a new thing for you. This image I have taken straight away from OP Karbanda. It is a metal chain which is hanging. Okay, see what is this metal chain depicting? This metal chain is depicting arch form. If we hang this a metal chain from 2 points, okay, it will hang like this, and this metal chain can depict an arch form. Okay, so this metal chain, most of you are marking it correctly. It is called as catenary curve. Okay, so if you see a metal chain which is hanging, so this curve denotes catenary curve. Okay, what is mushroom curve or mushroom arch wire? A wire like this is mushroom arch wire. It is used in lingual ortho. Okay, and what is braided arch form? Braided arch form is this. Normally our arch wires are like this, that distally they are going outwards, but in braided arch form distally the wire is coming inwards. At the end near molars the wire is again moving lingually. This is called as braided arch form. If the wire is again coming lingually, this resembles the shape of the trifocal ellipse. Okay, This is called as bladder arch fold. Clear? Very simple question. It has been asked many times. What is the first speech sound in a child? Yes, so the first speech sound in a child is bilabial. So bilabial is the one where we use both our lips. P, m, b, t. Sorry, p, b, m. ठीक है? Like P, B, M. So these are bilabial sounds. So this is the first sound which a child produces. Okay. Now someone had asked tip edge bracket. So tip edge is a combination of beg and edgewise. It consists of a single bracket consists of two types of slot. It consists of a diagonal slot like this. See, this is a diagonal slot and this is a horizontal slot. Okay. So remember, tip edge is a combination of beg and edgewise. It consists of a diagonal slot. Okay. And this bracket is called as RX1 bracket. Just remember this. Just telling you because you have asked. Okay? You just remember it's a combination of tip movement and bodily movement. Tip edge bracket. This also I have explained in class. What is wagon wheel effect? What is the answer of this? And you also have to tell the ratio because I have also explained you the ratio in class. Three, torque added, tip reduces. Correct. Correct. When we add lingual torque, okay, yes, the ratio also you have written correctly. So when we add torque, okay, by 4 degrees, we lose tip by 1 degree. So when you are pushing the roots, okay, lingually, they converge towards each other, which is called as loss of tip, that is 1 degree. So the ratio is 4 is to 1. 4 degree we add torque, lingual root torque to the incisors, 1 degree we lose the tip as the roots converge towards each other. Very good. So most of you have told this correctly. Now tell me this. Maximum lip thickness in males is attained by what age? Maximum lip thickness is attained by what age? Who can tell? Maximum lip thickness. Sixteen. Correct. So see, the upper lip thickness in males is achieved by 16 years and in females it is attained by 14 years. Okay. Lip length in males is attained by 18 years and in females it is achieved by 14 years. So in females by 14 years we achieve maximum lip length also, lip thickness also. But in males, lip length is achieved by 18 years and lip thickness is achieved by 16 years. Okay. Now, what is SND angle and where is it used? SND. What is D point? You know SNA, you know SNB. ठीक है ना? So SND. So D point is actually the, who can tell? D point is the center of chin. Okay. The center of the bony chin, it is called as point D. It again, like SNA, SNB, SND will tell us about the position of the chin. Okay. Answer is same, Steiner analysis. So this D point is just to confuse you. Okay. SND is also used in Steiner analysis, but remember D point is the center of chin. Okay. You should just know this. This also I have explained you. In first 24 hours, an elastomeric chain loses its elasticity by how much? 10 to 30%, 30 to 50%, 50 to 70 or 80 to 100. Okay, how much does an e-chain loses its elasticity by in the first 24 hours? The correct answer is yes, third, 50 to 70%. Okay. A intraoral elastic, normal elastic. See, this is an elastomeric chain. Okay. An intraoral elastic like a class 2, class 3 elastic that loses 30%, okay, in the 24 hours. Normal elastic like your class 2, class 3 elastic loses 30% elasticity in 24 hours. Each chain loses 50 to 70% elasticity in the first 24 hours. Okay, just a revision for you. So most of you have answered this correctly. Now, this, can anyone tell what is this? I'll give you a hint. See, this is a removable appliance. Everyone knows because it consists of a plate. You have Adam's glass. They will go like this. We have banded the molars. Okay? This wire over here, it is a finger spring. So with the help of finger spring, we are, and you can see there's a space over here. So with the help of a finger spring, we are applying distal force on the molar. Okay, so this is a removable distalization appliance. We are achieving distalization with the help of a removable appliance. Okay, yes, someone has written the answer correctly. This is a echo appliance. Echo, acrylic. Okay, cervical occipital appliance. Acrylic, it is not a pendulum appliance. Pendulum is fixed, distal jet is fixed, ठीक है, Jones jig is fixed, but this is a removable. So here we have finger springs which is applying a distal force, and see cervical occipital, we also use a headgear with this appliance, and this headgear will also apply a distal force. So this is no longer used. It is a very old appliance, but just for your knowledge you should know this. Okay, it has been asked once, that's why. Okay, this is called as a echo appliance. What is this? Identify a simple appliance. Not an appliance, just an auxiliary. It is used to correct rotations on a tooth. You can bond it on a tooth surface. Okay, and help in derotating a tooth. You can achieve various other movements with this. and it is very simple. I have not given any options. See, it looks like a button in a kurta, correct? It is a lingual button, correct? It is a lingual button. If I would have given you options, then definitely you must have, must have given the answer correctly. Lingual pleat is like this, okay? It consists of two wings. Lingual pleat. Lingual button is like this, okay? So lingual pleat will have two wings. It won't have a small round button. Now, which laser is used for debonding orthodontic brackets? I showed you a debonding plier, correct, with the help of which we remove the bracket. We can also soften the composite first with the help of, if we apply a laser, the bracket will come off very easily. Can you tell which laser we use if we are using a laser for debonding orthodontic brackets? A, correct. So this is the most common laser we use. So this is your first choice. Second choice will be your CO2 laser. Okay. Second choice will be your CO2 laser. These are not used for debonding. Argon and anti-ag is not used. First option is will always be your first choice. Okay. If EAG is not there, then you can mark CO2 laser. Okay. Now, what is this? Can anyone identify this? Identify this. What is this? I'll tell you, this appliance or this machine helps in preventing breathlessness during sleep. What is breathlessness during sleep called? Sometimes what happens is the patient will suddenly awake. He'll wake up because his breathing stopped, his oxygen saturation has reduced. Yes, so this is actually a CPAP machine. Correct, very good. So what is CPAP? CPAP is continuous continuous positive air pressure. So what is obstructive sleep apnea? ठीक है? See, obstructive sleep apnea. What is sleep apnea? Apnea means ठीक है, cessation of breathing. Okay, that your breathing has stopped. So apnea is actually at least 10 seconds of breathlessness, that for 10 seconds you have stopped breathing, which leads to 3% decrease in your oxygen saturation. So there was 10 seconds of obstruction which led to 3%, at least 3% decrease in your SpO2. Okay. Now OSA is obstructive sleep apnea, we say when there are at least 5 apnea episodes in one sleep hour, and because of that the patient is again and again waking up. So when the patient lies down, his trachea, there was some obstruction, his tongue has fallen back, whatever it is, and the airway has obstructed, and this has occurred at least 5 times in one sleep hour. So that is called as obstructive sleep apnea. And CPAP machine, this is diagnosed with the help of someone has written polysomnography. ठीक है, where we do EEG, everything. When the patient is sleeping, we check the respiratory pattern, and this CPAP machine helps in the, it is a It helps in providing continuous air so that this episode does not occur to the patient while sleeping. Okay. Yes, it is a non-invasive type ventilator, you can say. But that non-invasive type ventilator, actually it is a BiPAP machine, which you are saying. That non-invasive ventilator which you are saying is a BiPAP. This is also non-invasive, but it is not a ventilator. BiPAP machine will suddenly it helps the lungs in inhaling and exhaling. When the lungs are not able to provide so much, they are not having this much capacity to expand and deflate, then BiPAP machine helps in that. It will thrust the air in and out. Okay? But CPAP, it is just providing air. Okay? No, there are no side effects of this. You need to have a humidifier also. The main, not side effect, disadvantage is that it makes a lot of noise. CPAP machine. Okay? So most of the questions, I must say that 60 to 70% questions, or maybe 80%, all of you have marked correctly. You have given the answers correctly. So keep it up. We'll meet again with further quizzes for all of you guys. Okay? And I'm sure this was a good revision for all of you. Okay? So we'll meet again with another quiz very soon. Thank you.